Hello everyone, I'm the Dr. Jong of Lih-Ren Clinic. It is often said that eye is the window to the soul. People with beautiful eyes are beautiful. Young people hope their eye is bigger as possible. When one is getting older, the eyelid skin droop. Therefore, eyelid operation, especially double eyelid operation, is a common aesthetic operation. I will introduce the principle of double eyelid operation, the difference between incisional double eyelid operation and the suture double eyelid operation, as well as who is suitable for suture method and who is more suitable for incisional method. This photo is a person with single eyelid. Upper eyelid skin covers her eyes, so the eyes look smaller. After double eyelid operation, the dropped eyelid skin are pulling up so that eyes look bigger. The other situation is that eyes with higher fold look brighter than low folds, so that some women with low fold come here and ask for higher fold. Relatively, the cost is cheaper than the other aesthetic surgery. It is very cost effective, so that double eyelid operation is very common practice in my clinic. There are two methods of double eyelid operation: suture method and the incision method. In suture method, stitches are buried into the location of new fold. The stitches pull the skin up when eyes are open. Eyelids are incised and the inner tissues are treated in incision method. Double eyelids are formed on the incision side due to tissue adherence. Relatively, suture method is an easier procedure. Let's introduce who is suitable for suture method. The operation details of suture method is below. Firstly, local anesthesia is injected on eyelid skin. 4 tiny wounds are made. Non-absorbable stitches are inserted and buried. The operation is done. There is no need to remove the stitches. Most of the people tolerate the non-absorbable stitches. It is a simple procedure and takes about 10 to 20 minutes. The stitches pull the eyelid skin up when eyes are open, but the weight of eyelid tissue pushes down on stitches. If eyelids are puffy, the stitches will lose their effect. The force will fade. In consultation, I use iron stickers to simulate the appearance of double eyelid and judge the puffiness of eyelid. If the double eyelid force can be maintained after I take out the stickers, her eyelids are judged to be thin. For people with thin eyelid, fading of double eyelid force is less likely. They are suitable for suture method. Take this single eyelid case for example. Above is before surgery. Middle is immediate after surgery. Usually only mild swelling is noted after suture method. Below is the picture taken 4.5 years after surgery. For people with thin eyelids, the recovery is quick and the double eyelid fall lasts for a long time. Another case, she had a low double eyelid force. She did not like it. Middle was the picture after suture method. A little bit swelling was noted. Below is the picture 6.5 years after surgery. Eyes with higher force look brighter than lower fold. This is another representative case. Left upper was before surgery. Right upper was the appearance immediate after surgery. Look like the appearance after crying. Left below is taken 1.5 years after surgery. Right below show the appearance of her eyelids. When she looked down, there is no scar on her eyelid. Another case, before surgery, immediate after, 9 days after, and 4 years after. The recovery is quick, result is good. She is satisfied. Next, I'm going to introduce who is not suitable for suture method. One is people with puffy eyelid. The four may fade, like the right eyes of case 1. You can see the difference between her right and left eyes. The four may be shadowed, like the case 2. In case 3, right four are shadowed, especially on the later part of her right four. Incision method is more suitable for people with puffy eyelids. The four are deeper and the fading is less likely after incisional method. Another situation is called ptosis. Ptosis of tarsus means that the distance of her left tarsus with center point of pupil is shorter, so that left eye is smaller than right eye. Below is the picture after suture method. Ptosis of left eye is not corrected in suture method. Asymmetricity of her eyes is the same as before surgery. Ptosis can be corrected by incisional method. Sunken eyelid is caused by atrophy or fat in the eyelid. They should be corrected by fat or filler injection. Upper is before, middle is immediate after suture method. Low is 2 months after suture. Suture method cannot correct her left eye sunkenness. When aged, upper eyelid skin will be loosed, especially on the lateral part, like this case. Suture method can make force higher and temporarily improve lateral hooding, but the effect is short. Upper was before picture of 43 years old woman. Middle is immediate after suture method. Hooding of her eyelid seems to improve. Below is the picture taken 2 months after suture method. The fold on her right eye is good, but left fold is faded. The appearance of her left eye is the same as before surgery. I recommend her to choose incisional method. The double eyelid folds last longer and the hooding part of her eyelid skin can be incised at the same time in incisional method. In summary, there are 2 ways of double eyelid operation: suture method and the incision method. Suture method is a good choice for people with thin eyelid because the recovery is quick. But the below conditions are not suitable for suture method. First is puffy eyelid. Fading of fold after suture method is high. Second is ptosis. Suture method cannot correct ptosis problem. Third is sunken eyelid. Fat or filler injection is needed. Last one is aged eyelids with skin laxity. Incision of hooding skin is recommended. I hope this information helped. Thank you for watching.